The Department of Orthopedics at the University of Iowa is a very special place where you learn foundational skills in orthopedics and musculoskeletal medicine. Really, it's sort of the Iowa way, if you will, learning how to maybe be a little more conservative in your approach to patient care and really treat each patient like it's your family member.
We offer virtually everything anybody could want in a residency. We have research, we have a VA hospital, we have high-level sports medicine with the Hawkeyes. We are the Hawkeye team docs.
You get a really broad-based training where you have exposure to all the different subspecialties, and you get hands-on educational experiences as well.
Orthopedics in general is competitive. There's a lot of time that's put in during residency and a lot that's expected in terms of education.
We're always looking for the best and brightest. We constantly hope to innovate in the way we teach, the way we educate, the way we train, and the way we provide care.
Each of our residents, I think, is extremely unique. We're looking for a diverse group of residents that kind of represent a lot of different talents and areas of focus.
Unique aspects of training at Iowa include our amazing state-of-the-art children's hospital. We are the only level 1 pediatric institution in our state, and so all of our residents are going to have pediatric orthopedic experience once they're out on their own, no matter what subspecialty they go into.
I think what set the University of Iowa's residency program apart is a great culture where it's extremely supportive, both within the residents and by the faculty as well.
We have a really good relationship with our staff. Everyone's very welcoming. We have an open door policy.
Being all together promotes a closer resident-faculty relationship in an environment that encourages year-to-year learning.
I think that really leads to more of a collegial and less of a hierarchical type setup.
We're really a family here, specifically within the orthopedic and the broader surgical programs.
Not only do I have a great relationship with my co-residents, but I feel like I'm making friends with my staff that are going to carry through even after residency.
In our free time, we like to get out and explore Iowa City. There's a lot to do, and we like to do it together.
There's constantly different activities going on, which really makes it a fun place to train. Music festivals, especially over the summer, but you're always having Friday night music downtown, a lot of good jazz artists.
We really like to get out on the reservoir, go out on the boats and do some wakeboarding or some skiing.
Iowa City is a great fit for anyone, whether you're single and just looking to form more relationships with friends.
Regardless of where you're at in your stage of life, there's a support system that's available for you too, which I think is really important when considering a residency.
Here at the University of Iowa, we're a little bit unique because we have both team-based learning as well as the mentorship model. We do some team-based learning such as our VA rotation where there's 2 third-year residents and a 5th-year resident managing the complex orthopedic service across the street at the VA.
That really promotes camaraderie. It gives you somebody to count on each day.
And then in the mentorship model, some rotations that we have, such as our joints rotation and our sports rotation, you're one-on-one with a staff member for about a month at a time.
You really get to earn that trust, develop graduated responsibility.
Starting day one as an intern, you're taking primary call on the weekend, and it really just gives you early responsibility and helps you grow.
You get your feet wet by doing simple procedures, and as your time goes on, you get to do more and more.
We work to earn that time in the operating room, and in return, the attendings will gradually give us more responsibility.
We have a really good didactic curriculum set up. We go to conference Mondays through Wednesdays. The faculty sets up anatomy skills courses for each of the classes actually.
We have access to cadaveric specimens if we're interested in doing practice dissections before a particular procedure, which I think is a pretty amazing thing.
I trained at a few different programs in residency and then fellowship before coming here, and I think the level of autonomy here is better than a lot of the other programs in the country.
In our setting here, we're trying to educate residents on how research is done, how to set up good research experiments, how to report that research. We specifically in the simulation area, these are skills they've wanted to master, they've wanted to have an opportunity to study and learn, and it's just really nice to be a part of that environment.
The resources are endless if you want to do research here. We have in-house statisticians as well as faculty who are on research tracks who have completed PhDs and done all sorts of research from the clinical side to the basic science side.
If you're interested in sports medicine, there are ways that you can get involved, whether it's with the football team, the basketball team, the wrestling team, soccer, softball, really doesn't matter. There are plenty of opportunities to get involved.
As far as our diversity goes, the University of Iowa has a very rich history when it comes to women in orthopedics, and I'm very proud to be one of those women here. And we are continuously looking at ways to expand our diversity going forward and celebrate our diversity in our department.
I appreciate the commitment to diversity. I think it creates a more inclusive work environment for us and helps us feel supported in our training. And then I think it also helps our patients feel like they're in a more inclusive environment.
I think every resident here at Iowa would say that they're extraordinarily grateful to be matched here. And I don't think any of us would trade it for any other spot. We do think we get phenomenal training, and it also provides an awesome work-life balance along the way.
It's really important that you choose a great program, a great fit for you, where you feel that you will truly become the best version of yourself and grow into a tremendous orthopedic surgeon.
Really paying attention to that gut feeling you get when you're talking to residents or when you're talking to staff on your interviews is going to help you a lot with your decision.
I would hope that you would strongly consider the University of Iowa for your training. I really and truly believe it's the best place to learn orthopedic surgery in the entire world.